Welcome back to another Deep Dive Med podcast. Today we're going to be talking about bronchodilators.
Oh, good topic.
Yeah, those are those medications that help us breathe easier when things get a little tight in the chest.
You've probably noticed that most of the respiratory medications that you come across are inhaled.
Right.
And there's a good reason for that.
Yeah.
Inhaling the medications allows for targeted delivery right where it's needed.
Okay.
The airways.
That makes sense. Smaller doses,
Exactly.
faster action.
Exactly. But to really appreciate how these medications work,
Okay.
we need to understand what we're treating, which is bronchoconstriction.
Okay.
It's a general term for narrowing of the airways, but there are a few culprits.
So it's like a traffic jam in our lungs.
Exactly.
But the cause of the traffic jam could be different. Could
Yeah.
be an accident, construction, or just too many cars trying to get through at once.
That's a great analogy.
Yeah.
And just like addressing a traffic jam,
Right.
we need to know what's causing the problem. Is it bronchospasm where the muscles around the airways are squeezing? Or is it inflammation where the airways are swollen and irritated?
Mm-hmm.
Maybe it's a buildup of thick mucus secretions. Each of these requires a different approach.
So it's not a one-size-fits-all solution.
Yeah.
We need to tailor the treatment
Exactly.
to the specific cause of the bronchoconstriction.
Absolutely. If it's bronchospasm, we want to stimulate the beta-2 receptors in the sympathetic nervous system.
Ah, the sympathetic nervous system,
Right.
our fight-or-flight response system.
Right.
Increased heart rate, rapid breathing, basically getting our body ready for action.
Exactly. And a common bronchodilator, albuterol, actually works by mimicking this fight or flight response to open up the airways.
Makes sense, but that also explains why we sometimes get those jittery side effects
Yeah.
after using an inhaler, right?
Yeah.
Like our body's going into overdrive even though we're just trying to breathe easier.
You got it. Those jitters, tremors, maybe a racing heart, those are all potential side effects of stimulating the sympathetic nervous system.
So there's a trade-off. We get relief from the bronchoconstriction, but we might also experience some of those unwanted side effects.
Right. Now, there's another short-acting beta agonist, similar to albuterol, called levobuterol or Afininex.
Okay.
It can be a little more targeted in its action, potentially leading to fewer side effects.
Interesting. So it's not that levobuterol is side effect free,
Right.
but it might get the job done with less of an impact on the rest of the body.
Exactly.
Okay.
Now, the choice between albuterol and levobuterol isn't always straightforward.
Right.
Levobuterol can be more expensive, and it might not be readily available at all pharmacies. It really comes down to the individual patient, their needs, and their response to each medication.
It's about finding that sweet spot
Yeah.
between effectiveness and minimizing those unwanted side effects. And speaking of side effects, regardless of which bronchodilator is used, careful monitoring is key, right? We can't just assume everything's fine
Absolutely.
after somebody uses an inhaler.
Monitoring is crucial. We always check vital signs like heart rate, respiratory rate, and oxygen saturation before, during, and after treatment.
We want to make sure the medication's doing what it's supposed to do,
Right.
but also be on the lookout for any signs of those cardiac side effects we talked about.
Right. Now, here's something that might surprise you.
Okay.
Sometimes a patient's wheezing can actually get louder after treatment with a bronchodilator.
Wait, louder wheezing. I thought that meant things were getting worse, not better.
It's counterintuitive, I know. But think of it this way. A partially blocked airway might make a faint whistling sound.
Right.
As the blockage clears and more air flows through,
Oh.
that whistling can become louder. It's the same principle with wheezing. Sometimes louder wheezing after treatment actually means more air is moving through the airways.
Okay, that's a good way to put it. Louder wheezing isn't always a bad sign.
Exactly.
Depends on the context.
Now, another important way to assess airflow, especially in patients with asthma,
Okay.
is through peak flow measurements.
Peak flow measurements. So that's where the patient blows into a little handheld device to measure how quickly they can exhale, right? Kind of like a personal breathalyzer for asthma.
Exactly.
It's a simple but powerful tool that allows patients to monitor their breathing at home
Right.
and catch early warning signs of an asthma exacerbation.
Exactly. It's like having a canary in a coal mine.
Right.
If that peak flow starts to dip, it's a signal to seek medical attention.
Makes sense. So what kind of improvement should we typically see in peak flow after someone uses a bronchodilator?
Ideally, we'd like to see an improvement of at least 50
Okay.
in their peak flow reading after treatment. And often it's even more dramatic than that. We commonly see improvements of over 100.
That's a pretty significant jump. But what if someone comes in really struggling to breathe and they can't even perform a peak flow measurement?
That's a red flag. And it could indicate a severe exacerbation requiring hospitalization. They might need continuous nebulized treatments or other interventions to get their breathing back on track.
It sounds like peak flow measurements can really help patients take control of their asthma management
Absolutely.
and hopefully avoid those trips to the ER.
Now let's shift gears a bit and
All
talk
right.
about a medication that's often used for a different type of airway issue. Racemic epinephrine.
Okay, racemic epinephrine. I'm all ears.
It's a synthetic form of adrenaline,
Okay.
and it works as a vasoconstrictor, meaning it helps narrow blood vessels.
Okay.
This is particularly useful for reducing swelling in the airways.
So it's not directly targeting the muscles around the airways like albuterol?
Right.
It's more about tackling the swelling itself.
Precisely.
Okay.
It's often used in conditions like croup, which is a viral infection that causes inflammation and swelling of the upper airways, particularly the larynx.
Right. Croup. That's the one that causes that distinctive barking cough, especially in young children. It can sound pretty scary.
It can be quite alarming for parents. Racemic epinephrine is often nebulized, meaning it's delivered as a fine mist that the child inhales, and it can help shrink that swollen tissue and open up the airways.
So it's a fast-acting rescue medication for those acute situations
Exactly.
where the airway swelling is causing significant distress.
Now, here's a fascinating clinical pearl about racemic epinephrine.
Yeah.
It's very sensitive to light and heat.
Oh, really?
I wouldn't have thought of that. It's true. It comes in a special metallic packaging to protect it. Once it's exposed to light or heat, it can degrade and become ineffective.
So it's like those old school photosensitive films. You had to be really careful not to expose them to light.
That's a good analogy. And just like a ruined photograph,
Right.
exposed racemic epinephrine won't work as intended.
So another reminder to always store medications properly
Absolutely.
and follow those instructions on the label.
Now, let's bring our attention back to albuterol
Okay.
and talk about a phenomenon called downregulation. Have you heard of that?
I've heard the term, but honestly, I'm a little fuzzy on what it actually means.
Well, imagine you have a dock with a limited number of spaces for boats.
Yep.
If too many boats try to dock at once, some will be left out in a
Right.
similar way. When we use albuterol frequently or continuously, our body can actually decrease the number of available beta-2 receptors in the airways.
So the albuterol is like those boats
Yeah,
trying to dock at those receptors to do their job.
Yeah.
But if there are fewer docking spaces,
right.
the albuterol might not be as effective.
Precisely.
Okay.
The body, in a sense, becomes less sensitive to the medication over time.
So it's not just that people are developing a tolerance
Hmm.
to the medication in the way we think about drug tolerance.
Right.
It's more that their body is physically changing
Exactly.
in response to the constant stimulation from the albuterol.
And this highlights why simply increasing the dose of albuterol isn't always the answer.
Right.
We might need to consider other medications or treatment strategies.
Now, I know there's another medication, theophylline, which is sometimes used as a bronchodilator, but I understand it's not as common as albuterol.
That's right, theophylline, or Theobid,
Yeah.
is what we call a third-line medication. It's not our first choice, but it can be helpful in certain situations.
So when might we consider using theophylline? What's its role in the grand scheme of bronchodilators?
Well, one of its key advantages is that it's taken orally, not inhaled. And unlike the short-acting effects of albuterol, theophylline can provide longer-lasting bronchodilation.
So it's more of a maintenance medication,
You know,
helping to keep those airways open over a longer period.
precisely. It can also help improve respiratory drive in patients with chronic respiratory conditions like COPD.
So it's not just about opening up the airways, it's also about stimulating the brain's breathing center to work more effectively.
Exactly. Now, it's important to note that theophylline has a narrow therapeutic range.
Okay.
This means the dose needs to be carefully monitored to ensure it's effective but not causing side effects. Too much theophylline can lead to problems.
And what kind of side effects are we talking about? What should we be watching out for?
Theophylline can affect multiple systems in the body. We can see things like nausea, vomiting, headaches, dizziness, and even heart palpitations or irregular heart rhythms. In severe cases, it can even trigger seizures.
Wow, that sounds pretty serious. Definitely a medication that needs to be used with caution and careful monitoring.
Absolutely. And the fact that it's a third-line medication emphasizes that it's not without its risks and limitations.
Right.
We typically reserve it for situations where other bronchodilators haven't been effective or are not well tolerated.
So it's not a first-line choice, but it's an important tool to have in our arsenal for those more challenging cases.
Right.
Now, we've talked a lot about the sympathetic nervous system's role in bronchodilation, but isn't there another branch of the autonomic nervous system, the parasympathetic nervous system, that plays a role as well?
That's a great observation. You're right. We can't forget about the parasympathetic nervous system. It has the opposite effect on the airways.
Right. The parasympathetic nervous system is all about rest and digest, slowing things down, promoting relaxation.
Exactly. And one of its actions is to constrict the bronchioles.
Interesting.
It's like putting on the brakes for your airways.
So we have this constant push and pull between the two branches of the autonomic nervous system. The sympathetic system stepping on the gas to open up the airways,
Right.
and the parasympathetic system tapping on the brakes to narrow them.
That's a great way to visualize it. And this dynamic interplay helps to finely regulate airway tone and ensure that our breathing is perfectly matched to our body's needs.
It's like a delicate dance between two opposing forces, constantly adjusting to maintain that perfect balance.
Precisely. And understanding this interplay is crucial for grasping how some other types of bronchodilators work,
Right.
namely anticholinergics.
Okay, anticholinergics. Now, those are medications that block the action of acetylcholine, right?
You got it. Acetylcholine is a neurotransmitter involved in many bodily functions, including the parasympathetic nervous system's effects on the airways. By blocking acetylcholine's effects, anticholinergics essentially prevent the parasympathetic nervous system from putting on those airway brakes.
So it's like taking away the parasympathetic system's ability to constrict the airways, allowing them to stay open and relaxed.
Exactly.
Okay.
And this is particularly helpful in conditions like COPD, where there's often chronic airway narrowing.
I've heard of a medication called ipratropium bromide or Atrovent. Is that an anticholinergic bronchodilator?
Yes, ipratropium is a short-acting anticholinergic.
Okay.
It's often used in combination with albuterol, especially in acute exacerbations of COPD and asthma.
So it's like a two-pronged approach, opening up the airways with albuterol, a beta agonist,
Right.
and preventing them from constricting by blocking acetylcholine with ipratropium, an anticholinergic.
Precisely. This combination therapy can be highly effective in those situations where we need to act quickly to improve breathing.
Now, are there any long-acting anticholinergics, something that provides more sustained bronchodilation?
There is tiotropium bromide, also known as Spiriva, a long-acting anticholinergic that's often used as a maintenance medication for COPD. It helps keep the airways open over a longer period, reducing the frequency and severity of exacerbations.
So it's like having a constant gentle pressure on the accelerator, preventing those airways from constricting and keeping things flowing smoothly.
That's a great way to put it. Now, as you can see, the world of bronchodilators is much more complex than simply puffing on an inhaler.
Right.
There's a whole symphony of physiological processes and pharmacological mechanisms at play.
Absolutely. We've covered a lot of ground today, and it's clear that understanding the nuances of each type of bronchodilator is crucial for making informed treatment decisions.
It certainly is. And this brings us to another important aspect of care: patient education.
We've certainly gone deep on these medications, and I can imagine it could be a little overwhelming for patients to keep all of this straight.
You're absolutely right. Patient education is paramount. We can't just hand someone an inhaler and expect them to understand all the nuances of how it works, what side effects to watch for, and when to seek medical attention.
It's about empowering them to be active participants in their care.
Exactly.
Right. We want them to feel confident and knowledgeable about their medications and their condition.
We need to break down this complex information into digestible pieces, avoiding medical jargon, and using clear, relatable language.
Yeah.
It's about building trust and rapport so that patients feel comfortable asking questions and sharing any concerns they might have.
It's like being a good teacher. You have to meet the student where they are and guide them along the path of understanding.
That's a great analogy. And when patients truly understand their medications and feel empowered to manage their condition, it can lead to better adherence to treatment plans and ultimately better outcomes.
It's a win-win situation. Now, thinking back on everything we've discussed today, what stands out to you as the most fascinating or impactful aspect of bronchodilators? What's the one thing you'd want our listeners to take away from this deep dive?
For me, it's the realization that bronchodilators aren't just simple airway openers. There's a whole web of physiological and pharmacological interactions that determine how these medications work and how they impact the body. From the interplay of the autonomic nervous system to the potential for downregulation with long-term albuterol use, there's a lot more to these medications than meets the eye.
It's a reminder that medicine is a constantly evolving field, And even seemingly straightforward medications can have surprising depths and complexities. And as healthcare providers,
Right?
it's our responsibility to stay informed, to be lifelong learners, so we can continue to provide the best possible care for our patients.
Could have said it better myself. And for you listening, I encourage you to continue exploring and asking questions about your health. Knowledge is power, and the more you understand, the better equipped you'll be to advocate for yourself and make informed decisions about your care.
And don't forget to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.